Thanks a lot. So yes, I'm a qualified speech and language therapist by background, and I currently work for NHS Education for Scotland. So my role is about developing and providing learning and education, primarily about person-centered care and about health and social care integration. So thinking about the learning and the education materials that's needed for social care workers, for care at home workers, and for care home workers that we heard from Bella earlier on. As a speech and language therapist, I'm also involved in education for allied health professions. So that's people like physiotherapists that are involved in the long COVID rehab work and chest respiratory problems, for dietitians, for podiatrists, for drama therapists, a whole range. I'm saying those because the NHS isn't just doctors and nurses, and I have no remit for doctors and nurses, but I'm busy with the education that I have. And every time policy changes, advice changes. And every time that happens, the education and information that's being provided has had to change too, to keep up with that. So the NHS in Scotland, part of my brief was to make sure we brought into today's discussion that kind of variation of the different devolved countries. So the NHS in Scotland is devolved to the Scottish Parliament. Health is a totally devolved issue, and so it does differ from England. All healthcare in Scotland is delivered by 14 health boards that have like a territorial area that they deliver healthcare services to. And there are 7 special health boards that are national across Scotland. So Scottish Ambulance Service, for example, NHS 24, or indeed NHS Education, where I work, is one of those 7 organisations. One of the first acts of actually, once we had a Scottish Parliament, was to remove NHS trusts. So there are no trusts in Scotland. That was about taking out the purchaser-provider split that is in the NHS in England. So, and that move has meant that we have escaped the worst of privatisation in Scotland. So health and social care staff are employees of the NHS in Scotland. Not for Virgin or other for-profit companies, but, and it's a but, contracted out services like catering, like estates work, like council services providing support as well, they are run by private for-profit companies. So Circle, Serco, etc., these companies we've already heard about today, they are making their profits in Scotland too. I was deployed as part of the setup team for the Louisa Jordan Hospital in Scotland. It's not the exact same as Nightingale Hospital, but it's 1,000 beds that have been put into what essentially is a rock and roll venue in, and was created, I think, as, again, partly a confidence boost to say, look what we can do. We can get a hospital created in only a few weeks. I think that happened across other parts of the UK too. But of course, the limiting factors are that it is a rock and roll venue, so the admissions criteria has to be quite strict in terms of, you know, other emergency services are not on site. So you reduce who could be admitted, and then where do you get your staffing from? You're just dipping into the small staffing pool across the piece. So our hospital has never opened as it was intended to be as a COVID hospital. So that's where I work. I'm also a trade union member, and I'm also the trade union rep in my workplace. And as you said, I'm a United Gazette Council member. I stood for election as part of a left group within Unite called United Left Scotland. I'm also a Labour Party member. I stood as, I've been the CLP secretary. I stood as a candidate for Westminster in Scotland twice, both 2017 and 2019. And I'm a member of the left group within the Labour Party, which in Scotland is Campaign for Socialism. It's an automatic membership momentum if you join Campaign for Socialism. I'm also a member of the Glasgow COVID-19 Action Group, People Before Profit. I'm going to come back to that. I'm just mentioning this because I want to come back to this. But in terms of NHS Scotland and COVID, we have a population of 5.5 million, not massively different to New Zealand in terms of our population. But it's really challenging when we constantly compare ourselves with England, and we regularly, even within the left, we regularly say, oh, well done, Scotland, you're doing better, or that is giving a real complacency about what the situation is and the stats are in Scotland. I'm just going to share my screen because if I just read out stats, you're not going to hear them. So can I just do that so that it's easier to see these? Share. Thanks. I'll leave it as it is. So, here we've got the populations of both Scotland, of Wales, of Northern Ireland and England. And what I've got here is the tests that have happened. So how many tests have taken place? And of those tests, how many of them have been positive? And then how many deaths have there been in our different 4 countries? And what is that as expressed as a percentage of the population? So Scotland has had 6,686 deaths. As of this morning, when I checked, it's up again, it's now 7,704, but leaving with the figure, with the comparative figure from the same date. Wales, 4,145. From our populations, as a percentage of the population, Scotland has had 0.08% of our population have died with COVID written on the death certificate. In Wales, it's 0.06% of their population have died with COVID written as part of the death certification. Northern Ireland, it's higher, 0.1%. And in England, 0.07%. So just sometimes, you know, the hard case there of like, but I'm just going to move on because I've mentioned there with the word COVID is on the death certificate. So that's about testing. So what are we doing about testing? So back on the 20th of April, I've picked these dates because they're relevant for Scotland. The 20th of April was a high point in Scotland back at the beginning of the first wave. 20th of April in Scotland, the number of tests that were carried out were 5,062, of which 776 were positive. That was a 15% positive test rate of the people we were testing. In England, the figures were different and the percentage rate was much higher, 29%. In the summer, on the 8th of August was our lower point, and the number of tests you can see there and how many of those were positive. Look, England and Scotland were the exact same in percentage terms. We were sitting, back in August, we were sitting at 0.5% of people being tested were positive. There was a chance to try and clamp down and go for a zero COVID strategy. On the 29th of December, we know the facts and the figures have gone sky high, and we fear that Scotland is following where England has already gone, where a quarter of the people being tested and the test numbers have gone up massively were positive. But to try and understand the stats is really hard. How can you compare like with like when we record different things? So to have COVID written on your death certificate, you needed to have been tested, but how many tests are we doing? Those aren't number of people tested, that's how many tests happened. My daughter has had about 8 tests altogether, I've had none. So we're nowhere close to be undertaking mass testing, a really key part of a zero COVID strategy.
2 minute warning, Helen.
That's fine. I just wanted to say, look, it's not Boris, but in Scotland, we are not doing great. And it's about revisiting some of the campaigns. And I said the number of different groups that I'm part of and the different actions that I've taken part in, whether it's Labour Party activity, whether it's Unite activity, we are split and we constantly fall out with each other and we form separate competitive groups. I'm trying to be in all of them to try and get some kind of coherence about these are our key messages. We need to test, test, test. We need PPE. We have to keep ourselves virus free. And it's those key messages that we need to come together on. It's no good all of our different left groups having another launch next week and another one the week after, another one the week after. If we are going to come together and put some pressure on all of our governments to do this approach better for all of us to survive, we have to work together as a left. We have to challenge that passivism, that trade union passivism that we spoke about, and we have to be comparing ourselves with the likes of countries who have adopted the right and correct policy procedures and not be doing this nonsense of like, oh, Scotland, at least you've got Nicola Sturgeon, who's a much better orator, and therefore somehow we're doing better. We might be doing better on some things than England, but that's a really poor comparator. So test, test, test. PPE, keep us all virus free. Thank you.